Hi everyone, Dr. Mankal here. I want to discuss today and give you some tips on whether you know that you're suffering with a disc injury or a disc bulge. We see this very commonly in the practice, and I want to show you a simple tip and tool and exercise you can help yourself. So I like lying in extension for a couple of reasons, which I'll explain to you here in a second. But I want to first take the time to explain to you the dynamics of the spine and how these disc injuries occur. I have my trusted old little source of my balloon here because it kind of represents what a disc does in the spine. And it's really just a cushion that sits between two vertebrae. When you tend to bend one way, it kind of bulges one way, you bend another. It's a very firm, cartilaginous, fibrous disc like in your knee, but yet different. And so it's very dynamic, allows our spine to have movement. And it allows also for these nerves that come out between the bones to signal tissues. So you have nerves that supply muscles, you have nerves that are sensory to our brain, and you have nerves that supply organ systems. So people all hear a lot about people injuring their disc in their back, and it's very common. And so I want to show you the test, first of all, that whether you know whether it is a disc problem or maybe coming from something else. And the one test that we always like to do is called the sitting straight leg test. So typically what happens when a disc is injured, it's more irritating and painful to sit for too long, okay? It's painful in the morning because the disc rehydrates at nighttime. But sitting for prolonged can really bother people. And so the way that you determine that is if when you're sitting, if I was to straighten out my leg and I kind of pull and stretch that sciatic nerve area, I may get more pain into my hip or into my buttock or down my leg, sometimes going all the way down to your ankle and your foot, all right? If that doesn't quite do it, then we have people come just flex their head down to see if you get any pain into the hip, down the leg at all. That's a positive sign for a possible disc issue. So if that's positive with you, one of the things that you can do is to try moving the disc if it bulges. If it bulges too much, it actually almost like it sprains a ligament. It bulges off to the side, and because those nerves are right beside it, they get easily irritated. So one of the things that can be very healthy for a disc and a spine is to put yourself in some extension. Okay, and this is what it looks like. And there's three parts to it. The first one is what I call position 2. Position 2 is a very passive extension of the lumbar spine. Pain should not go down your leg. If you feel some pressure in your lower back, that's okay. So we recommend people try lying like this for 10 to 15 minutes, just like that. Grab a book, do whatever you want, but see if you can handle that for 10 to 15 minutes. If pain goes down your leg, you should not be up here. We want you to go down a little bit lower, what I call position 1. And do it at several minutes a day, a couple of times a day, but the ultimate goal is to try to get to position 2 here for 10 to 15 minutes a couple times a day. Some people use ice in the lower back, which is a good strategy as well to reduce some of the swelling there. And eventually, once you can do this for a week in the position 2, we ask you to do like what I call a crab in a full extension, okay? I'm straightening up my elbows, okay, and I'm holding that for about 15-20 seconds. Then I'm gonna come back down into the position 2 format again, okay? So those are the protocols here. So position 2 is ideal. We want it for 2 times a day for 10 to 15 minutes with the ice application, okay? And so that will help centralize or move the disc back into the center. So that's one strategy that I would initially start off recommending for you if you have that positive sign for the disc issue. So one of the common things that can create this thing is some people tend to have what we call a structural shift, where the spine is shifted, okay? And it creates a shearing force or load into the spine. And that can be the weak link that maybe set this up in the first place. And so sometimes this can be very helpful. Other times may require other treatment methods as well. And so, but I want you to first start here to see if that gives you some relief and comfort with that. If you're still having some challenges, you should probably consult someone, give us a call here, or message me. We can give you some directions of what to do next from that. So I hope you find that helpful for you. Try the prone extensions with the ICE protocol there, and look forward to you telling me how you're doing with it. And we'll talk soon. Bye for now.